Good evening, one and all. We are the team of doctors from Bangalore Baptist Hospital. I am Dr. Vinod. This is Dr. Spurgeon. This is Dr. Justin. We welcome you both to our show. Dr. Spurgeon is a senior endocrinologist at Baptist. He has done a super specialty in the endocrinology at CMC Vellore. And Dr. Justin has done his endocrine from Ramya Hospital. We welcome you both to our show, doctors. And I am Dr. Vinod. I am working as a physician here in Bangalore Baptist Hospital. I am also into geriatric medicine.
Thank you for your kind introduction, Dr. Vinod.
The discussion for today is on diabetes, especially in this COVID situation. We thought it would be helpful for all the patients and all the people around the globe who are interested in listening to diabetes and how to control diabetes in this COVID situation. And also want to tell that in this COVID situation, we've taken social distancing quite important. So we are 4 of us here, including the cameraman. So with no further delay, we'll start our discussion on diabetes. Over to Dr. Spurgeon. So can you tell what diabetes is?
Yeah, diabetes is a common condition that we come across. I think most of you who are listening, maybe one of your family member or one of your relation must be having this condition. The basic problem is that there is the problem either with the production or else with the action of the insulin in our body. And it is generally related to the carbohydrate metabolism. When there is impairment or else defective production of the insulin in our body, the carbohydrates will not be metabolized, and therefore as a result the glucose levels in the blood will go high. And if you do not treat this condition, it can cause various complications. Yeah, you can also add on, Dr. Justin.
Yeah, I think sir has pretty much explained what diabetes is. So the term diabetes, it comes from an ancient Greek word which means to pass through or siphon, and the reason for putting this name by the ancient Greek physicians was because there was excessive discharge of urine, and the term mellitus was added later on. It basically refers to the honey sweet taste of the urine, and it was noticed by the ancient Indian physicians that the ants were getting attracted to the urine, and that was a way of diagnosis in those days. Little sound problems. It was not.
Give the thumbs up to continue.
This is a channel.
Should we start again?
Start from beginning.
Start.
Yeah, sorry for this technical glitch. We are coming back again. Okay. So as Dr. Justin has mentioned, this is a common metabolic disease. In the good olden days, they used to diagnose by looking at the urine which attracts the ants. I mean, I had a funny experience while I was doing my endocrine training in CMC Vellore. I had a patient who came all the way from Northeast. While I was taking the history, how he was diagnosed to have diabetes, he said like this: I have the habit of drinking a little bit of urine every single day. In fact, if you remember, one of our previous Prime Ministers, Morarji Desai, he had this habit of tasting his own urine. So he noticed while he was doing that, his urine became sweeter and sweeter, and there's a time he got the doubt whether he might be having diabetes. He went, and therefore he was diagnosed to have diabetes.
Okay,
What do you, Dr.
That's really nice. Dr. Justin, can you tell me what are the types of diabetes and how do you diagnose them?
So presently we know that there are mainly 3 kinds of diabetes, and I think it would be interesting for us to know that the ancient Indian physicians like Susruta and Charaka, they had distinguished between the 2 main types of diabetes. That is diabetes that occurs in the youth and diabetes that occurs in overweight individuals. So we have type 1 diabetes, in which, like Dr. Spurgeon explained, there is little or no insulin production, and this was previously known as insulin dependent diabetes mellitus. Then there is type 2 diabetes mellitus, which is the most common type of diabetes that we see. So there are two causes there basically. One is the body does not respond to insulin, and the second is that the body does not make enough or adequate insulin, and sometimes it can be the combination of both of them. And the third type of diabetes that we know about is the diabetes that occurs in pregnancy, which is known as gestational diabetes mellitus, and it usually resolves after pregnancy. In addition to this, there are other rarer types of diabetes which can occur as a result of genetic problems when you take certain medications, which can be because of problems that happen within the pancreas. So these are broadly the types of diabetes that we know about.
Dr. Spurgeon, how do we control diabetes?
Yeah, as I have been in this field for the past couple of decades, I see these are the 4 important things for anyone who has diabetes to follow these things. Number 1 is a diet, lifestyle modification. Number 2 is the exercise. Number 3, if the sugars are not under control with the diet and exercise, for people who are having the type 2 diabetes or even the gestational diabetes, which Dr. Justin has mentioned, there is a need for them to be on medication. Okay, and don't forget the 4th one, which is very, very important. The 4th thing is monitoring on a regular basis, because diabetes is a dynamic disease. We cannot fix a treatment today and hoping that this treatment will be valid for the next maybe 3 or 6 months. The cells inside the pancreas, the beta cells which produce insulin, they progressively degenerate and decay, and therefore there is a need for us to adjust the medication looking at the sugar levels. So these are the 4 pillars which we need to keep it in mind: diet, exercise, medication, and the 4th one is monitoring. So these are the 4 pillars in managing the sugars.
That's wonderfully put. So Dr. Justin, can you tell, you have anything?
Yes, I think the point that Dr. Spurgeon mentioned about monitoring is very important, because oftentimes we see that the patients, after they are initiated on medications, they somehow feel that the sugars are going to be controlled. It should be underlined and told that the patient should come back to the concerned physician with their blood glucose levels and get the medication adjusted accordingly.
I think there were many experiences we can share where the patient comes and sees us a couple of years back, and now he comes after many years using the same medication, but when we check the sugars, they are very high, they'll be very high. So monitoring on a regular basis is another important thing which we need to keep it in mind.
Yes, Dr. Spurgeon. Can we control diabetes only with diet, Dr. Justin?
So, as Dr. Spurgeon very clearly mentioned, and he said about the 4 important 4-pronged strategy for treating diabetes, diet is the most fundamental among them. So, I hope you must have heard of the ABCs of diabetes, which is A1C, which is the blood glucose, it is a blood test which shows your 3-monthly blood glucose levels, and B stands for your blood pressure and C stands for your cholesterol. So all these 3 aspects in managing diabetes are fundamentally, they have diet has to play a role in that. And carbohydrates are the main component of our diet, and that is the main source of energy. And the carbohydrates are the one that primarily affect our sugar levels as compared to your protein and fat. Now, there is no one size fits all strategy or a diet plan for treating diabetes. The diet plan has to be decided based on the activity of the person, the weight of the person, and I think taking the services of a dietitian would be very helpful in that. But the easiest and one of the most practical methods for us to say about diet would be something called as a diabetic plate model, in which if you have a plate and that is used for serving, 1/2 of the plate should be filled with non-starchy vegetables, and the one quarter of the other half, one quarter should be filled with whole grains like rye or oats or bran or millets, and the other quarter should have a protein content, which primarily should come from lean meat or fish or egg, or in the Indian context many times pulses or dal. And it's also important for us to know that we have our mid-meal snacks, because it helps us to prevent hypoglycemia, and also it helps us to prevent overeating at your main meals. And I think it's always important that you take fruits instead of fruit juice. So that is basically how a diet pattern should look like.
Yeah, the common thing that I say to the patients is that all the vegetables above the ground level, you can eat as much as you can, as you want. And all the vegetables below the ground level is better we try to avoid, because roots and tubers, they have the carbohydrates, So vegetables above the ground level, that can, you can take any amount, whatever you want.
There are some patients who come and say they have their religious beliefs. They can have meals only twice a day, or they are having their fasting, or they have only once a day, or they're working and they have like breakfast at 10:30 and they have dinner at 10:30 in the night. How do we advise diet for them?
I think, for example, Ramadan season,
Yes.
they try to eat before the sunrise and after the sunset. I think it all depends upon the stage of the disease and the kind of medication that the people are taking. So based on these things, we try to regulate the regimen where the sugars will not have rapid huge fluctuations like the high sugars and the low sugars. We need to look into the medication that the patient is taking and then try to adjust that medication. For example, if the patient has an insulin, it is better you give a short-acting insulin, at the time of the meal, which will be able to control the sugars.
Okay, so it's very much individualized.
Yeah, it's individualized. Depending upon the medicines the patient is taking.
And are there any specific forms of exercises would you tell a diabetic patient?
So exercise, again, that is the second key component of controlling diabetes. It refers to any physical activity which involves your major muscle groups. So the recommendations for exercise are, for a diabetic patient, would be at least 150 minutes weekly, 3 days a week, with no more than 2 consecutive days of not having exercise. So exercise predominantly would be having your aerobic exercise and your resistance training, and in addition to that you can also have your stretching exercises. So it's important to find a balance between all the 3 groups, and because some patients come and tell me I do stretching exercises, but that will not just help in getting the sugars into control. You need to have aerobic exercises as well, and we should be very sure that you contact your concerned doctor before you start any particular kind of exercise, because there are certain situations in which you should avoid certain kind of exercises.
I think it's a good thing what Dr. Jason said. For example, if you have any problem with the foot, it's preferable before you start the exercise, to see whether your sugars are under control or not. And if you have an ulcer history or else any wound, it's better under control, and then proper and appropriate footwear is also very important before you go for the regular exercise regime.
Yeah, we have a question from one of our viewers. One of our friend's sugars, his father's sugars got controlled very well with this medication. My sugars are still uncontrolled, doctor. Can I change to his medications? What would you suggest, Dr. Justin?
So it's very important for us to realize that if your doctor prescribes a particular set of medications for you, it's for you only. So if your sugars are uncontrolled, you have to meet your doctor and get the medications adjusted correctly, rather than taking your friend's medications or your neighbor's medication or even your family member's medication. Remember, like all other medications, if diabetes medications are taken unsupervised and not in the prescribed dose, they can cause side effects.
It can cause either high sugars or else low sugars. All these complications could occur.
Thank you, Dr. Justin. We have another question on, can stress cause diabetes? To Dr. Spurgeon.
Yes, I mean stress is,
And does it cause fluctuations of the sugars?
yeah. Diabetes is basically a multifactorial disease. Insulin plays some part of it. Lifestyle, the kind of lifestyle that you are living, and the kind of a diet that you are taking. Apart from these things, person who has additional stress, work stress, that also contributes to the fluctuation of the sugars, that also contributes to the causation of diabetes. Not only the causation, but even when the patient is on medication, the people who are having more stress levels, those were the times the sugars can go high. Okay, so anxiety is very much associated with uncontrolled sugars.
What would you tell them to do it on a regular basis for a patient with anxiety has diabetes? Any ways of tips to manage them?
So one of the important things, like Dr. Spurgeon mentioned, is about stress and diabetes. That's a very important topic now. Stress is it's a part and parcel of our fast-paced lives. We cannot avoid stress in our life. But many times stress is good because it helps to bring out the best in us. If you were to look at the problem what stress causes, it increases the counter-regulatory hormones in our body. And some people without diabetes will be able to overcome that by producing more insulin, but for those of them who have diabetes, it may not be possible, and that just pushes up the sugar levels. And one of the main ways in which we could cut down on stress is to take life as it comes, relax. One of the things that I would do is to spend time with God, reading the Bible and praying. And it's also important that you spend adequate time with your friends and your family, and don't take the stress from your work to home. Whenever you enter your home, leave your stress outside and then enter your home.
I think during this COVID season also there is additional stress for the people, because they are physically distanced and they were lockdown period staying at home. That is an additional cause for the stress especially during this season. Yeah.
Dr. Spurgeon, what would you advise to a patient with diabetes in this COVID situation?
So COVID brings in a different kind of a scenario, especially during the COVID, especially during this lockdown. Okay. The first thing is that, as we know the facts that the mortality is generally higher in people who are of old age and also who are having the risk factors like diabetes, hypertension and the cardiovascular disease. Okay. With regards to the control of the diabetes, because of the lockdown, most of the people who came to me in the recent past couple of weeks, they were telling, we are not able to go out, we are inside the house, and therefore my exercise regime, I'm not able to follow my regular exercise regime. So if you cut down your exercise, what will happen? Naturally the sugars will go up. But I think because of the existing situation, we need to try to modify the lifestyle. Probably we have to do some exercise even inside the house, maybe Zumba or else Pilates or else something like that, which will help us in controlling the sugars, and diet will continue to remain the same, but in case if you are having diabetes and the sugars are not under control, we need to take extra care, because of the associated morbidity and the mortality, because of the COVID. Okay, so and again, if you are admitted with the COVID, then it's a totally different scenario. But these are the general things that we need to keep it in mind. So, Dr. Justin, I think it has caused a significant change in the people lifestyle. They are generally, homebound, not able to go out for exercise. What is your experience with the patients that you have seen over the past couple of weeks?
So I generally see that the sugars become uncontrolled. As rightly pointed out before, the stress levels are quite high and the sugars come uncontrolled, and then we have to take the necessary steps to bring it into control. I think it would be very important for the, like Dr. Spurgeon was mentioning, that the patient checks the sugar levels regularly and more frequently. Try to maintain it around 180 milligram per deciliter, and also try to prevent hypoglycemia. Hypoglycemia is less than 70, and it's also important that you be active. So don't sit continuously for more than 30 minutes. Every 30 minutes you stand up and you walk, climb up, climb down the stairs, and stay hydrated. Drink adequate amount of fluids. It would be good to take a small sip of water every 30 to 45 minutes, but that should be always in accordance with the limits that have been set by your doctor. And it's also important that you get adequate sleep. 8 to 10 hours of sleep is very important, and keep adequate supplies of diabetes medications at your home.
Yeah. So we need to control the sugars, and number 2, we need to boost up our immunity to face the COVID infection in case if you are affected. And the third thing is, when you go out, it is always very important for you to use the mask and the physical distancing, because if you are affected with COVID, your immunity will be low and the severity will be very high for the people who have uncontrolled sugars. And the other important thing is that during this lockdown season, many of the medical shops were closed. So it is important, if you are on insulin or as or on medication, you don't stop your medication. Okay, try to get the medication and try to and continue to use that medication.
Okay. One of our viewer, Mr. Easow Sam, has asked a question. His blood sugar is high in the morning and later it comes down. What would be the reason and what should I do about it?
Yeah.
So usually what happens is, so we need to be exactly knowing what medications the patients are on. But sometimes what happens is, if there is an increased dose of insulin that is given at night, the patient could be developing hypoglycemia around about 2 a.m. to 3 a.m. And in the morning, because of the increased counter-regulatory hormones, the hormones which try to defend against hypoglycemia, might overreact, and because of that the sugars come up in the morning. So we have to check what medications the patient is on, and if it comes down later, we have to make sure that the patient has been taking his mid-morning snacks regularly, because the usual time that we see hypoglycemia is pre-lunch. So when there's a huge gap between your main meal that is in the breakfast, and your lunch, the patient develops hypoglycemia.
And if this is the first time that the sugars are high, I mean, he's not a known diabetic, it's the first time he's detected to have high sugars.
Yeah.
In that case, Dr.
So if you do not have diabetes, and if you see the sugar pattern, like the fasting sugars are slightly on the higher side, maybe 110 or 120, and the sugars after the breakfast goes low. So this entity we generally see in people who have pre-diabetes, not the normal stage and not the diabetic stage, but in between. What happens is that we call it as a reactive hypoglycemia. Okay, so what we generally need to do is that we try to go for the lifestyle modification, because you are there in the pre-diabetic stage. Okay, and then try to eat small and frequent meals and try to use a complex carbohydrates. Okay,
example.
Complex carbohydrates like like starch based.
Yeah, you have whole
grains, other
bran, oats, millets.
Millets.
I think millets, I think most of them are used to it.
Yeah.
Tradition. We have another question by Mr. Abhimanyu. His wife is having blood sugar. Is there anything to be considered while planning for pregnancy? To Dr. Spurgeon.
Yeah. So this condition is basically you are having diabetes and now you are planning for pregnancy. What are the precautions that we need to take? So the first thing what we need to do is that basically we need to keep the sugars under good control, preferably HbA1c, which will generally tell us the average sugar control over the past 3 months. Ideally it should be less than 6.5 before you plan for pregnancy. Even less than 7 is also acceptable. That's number 1. And number 2, generally diabetes is also associated with multiple other comorbid conditions like high cholesterol level and high blood pressures. And there are many medications, which are not supposed to be used before you plan for pregnancy. Okay, so we need to, stop the medication which could cause potential toxic effects if you're planning for pregnancy. There's a second thing. And the third thing, okay, it's better we start the folic acid so that you will not develop the child will not develop any neural tube defects. Okay, so you need to see the doctor. You need to make sure all the things under control and you are on the right medication which will not cause any toxic effects when you plan for the pregnancy. Okay. Now after taking these precautions, then you can plan for pregnancy. And once you become pregnant, we need to understand during pregnancy we cannot use many medication what are generally used for treating diabetes. You should be on insulin, or else you could use metformin. But if you are already having diabetes and you will become pregnant, so you will be on insulin and you need to control the sugars very tightly. Okay. And the other important thing, before you plan for pregnancy, we need to make sure you do not have any complications in relation to the diabetes. So we need to screen for the complications of diabetes and then make the necessary decision so that once you become pregnant, there should not be any major problem. So Dr. Justin, adding on to that one. So how do you monitor this patient? A patient has diabetes now has become pregnant. What are all the precautions you take?
So like Dr. Spurgeon mentioned, it would be very important to look at the complications, and you should define the periods in which, or the trimesters in which the further screening of the complications should take place. And another one is the important thing to know is that you should have a home-based self-monitoring blood glucose system. And the targets which we generally set are fasting values of less than 95 and the 1 hour postprandial levels of less than 140. So remember that in diabetes in pregnancy or gestational diabetes mellitus, it is not the 2 hour that is important, it is the 1 hour that is important, because the 1 hour sugar, the high sugar levels are the primary driver of the complications. And it is important that we monitor frequently and get back to the doctor as soon as possible to get the medication level, the dose of the medications adjusted. In addition to this, we should also be careful about the diet and the exercise, which is very important. So diet in pregnancy, it is important to realize that it's not dietary restriction, it's dietary modification, because the target during pregnancy is not weight loss but having an adequate weight gain, or more technically we could call it medical nutrition therapy. And if obese patients have become pregnant, then they should decrease their caloric intake by 1/3 of their pre-pregnancy caloric intake, but it should be around about 1600 calories per day minimum, so as to avoid other complications. And about exercise, it is very important to be said that a pregnant patient who has got diabetes should walk for a minimum of 15 minutes after each meal. That's the bare minimum that is required, and over and above whatever can be done should be done, provided the obstetrician have given them a clearance for doing that.
Yeah, couple of things to add on to what Dr. Justin has said. The monitoring of the sugars during pregnancy is much more intense, so, and then the visitation to the doctor also is much more frequent, because as pregnancy progresses, the sugar levels will progressively go high, and therefore we need to frequently titrate the medication that you are taking. In Baptist Hospital, we have this provision of the patients can call us over phone, and our educator will take all the details and then and she will discuss with us, and then we have this facility of telephonic insulin adjustment of the sugars. Okay. Other important thing, weight gain during pregnancy. Once you have this gestational diabetes, generally it is said about the woman, they generally put on weight after marriage, and the second time where they put on weight is during pregnancy. Remember, putting on weight is very easy, but to shed the weight is very, very difficult. If you have gestational diabetes, there is high possibility that you will develop the diabetes later on in life, and therefore it is very important not to put on more calories, more kilos during pregnancy, and even if you put on little bit of weight during pregnancy, post delivery it is important to shed those kilos, and therefore medical nutrition therapy is very, very appropriate and important, as Dr. Justin has said.
Okay. We have another question from Mr. Daniel. He is asking that his wife is in 3rd month of pregnancy and she's a diabetic. What should be he worried about? What complications can happen if the sugars are not controlled?
So the complications of diabetes in pregnancy can be classified according to the trimester. If the sugars are uncontrolled in the first trimester, generally it leads to neural tube defects like encephaly. There can be deformities with the spinal cord, and after that the complications will predominantly be in terms of fetal macrosomia, that is big baby is what we call it.
Okay.
So that would lead to difficulties during labor, and the post-delivery immediately the baby can have hypoglycemia, hypocalcemia, low calcium levels, and the baby can be exposed to more infections. The mother can have what is known as polyhydramnios, English like so all these complications can happen because of uncontrolled blood glucose levels during pregnancy.
Okay. Thank you, Dr. Justin.
And all these things could be prevented if the sugars are well under control.
Yes, exactly.
Yeah.
I think it's worth enough to control the sugars during
Yeah.
pregnancy.
So one of the common questions which patients ask us is, doctor, will this diabetes disappear post-pregnancy? So what I usually tell them, yeah, it usually resolves post-pregnancy, but there are chances it can remain after pregnancy also. So what we usually do is we get our blood glucose testing done at 6 weeks after pregnancy, and we decide if the medication should be continued or not.
And even after that also, every year it is good to check the sugars, because the possibility of developing diabetes is very, very high. Okay. And the other important thing, once you have the gestational diabetes, before you plan for the next pregnancy, make sure you check your sugars, and when they are normal, then you plan for pregnancy.
If I were to add a statistic there, it is shown that 60% of the women who have gestational diabetes mellitus develop type 2 diabetes mellitus at around 10 years after their pregnancy.
It's quite significant.
Yes.
Yes, we have another question from Mr. Shiva Prakash. I have fungal infection between the toes of my right feet, and I've been having severe pain in the right leg. I am using the cream for the fungal infection. What do I do next?
So this, with diabetes, the infections are very, very common. It could be a bacterial infection, it could be a fungal infection. But the way how you're describing, it looks like a fungal infection, candida infection. So if the sugars are not under good control, it's better you control the sugars. That's number one. And number two is, you can continue this antifungal cream. Okay. And the third thing is, you try to keep your feet dry, not to be wet all the time. It's preferable to keep the feet dry.
So speaking about complications of the foot, diabetes is shown to be the most common cause of lower extremity amputations. It is said that every 30 seconds, one uncontrolled diabetes patient loses his leg somewhere in the world. So foot care in diabetes is very important. We at Baptist, we have a diabetic foot clinic which runs in coordination between the surgeon, the endocrinologist and the physical medicine specialist. So, and that has been bringing a lot of positive results with the treatments that have been prescribed for the ulcers which patients have come. They have got a significant response.
Yeah.
Any precautions you want to tell a patient with diabetes regarding foot care, Dr. Justin?
Yeah. So one of the important things is, at least the bare minimum should be to have an annual examination of your foot in terms of looking at your neuropathy, looking at your blood flow, whether the vascular blood flow is adequate, and it's important to keep your foot dry, and but use a moisturizing cream but never in between the toes. And by all means, it is mandatory that a diabetic patient should use diabetic footwear so that the pressures can be maintained and balanced accordingly. But that should be after taking a consultation from the concerned doctor, because sometimes just a wrong footwear can be a cause of an ulcer.
Yeah. I generally tell my patients, once they develop neuropathy, when you get up in the morning, like how you see your face in the mirror, in the same manner, you have to look at your feet every single day in the morning and before going to bed. So it is that important. If you recognize it early, many complications could be prevented.
We have another interesting question from Mr. Sam. My sugar has been high in the morning and it would come down subsequently. I am on metformin once a day. What should I do?
Yeah, I would like to know whether the indication for metformin is it because of the reactive hypoglycemia or else whether he has diabetes. And the other thing I would like to know is how high is the fasting sugar. Okay, looks like metformin once a day, probably it might have been started for the reactive hypoglycemia. Okay, as I have said earlier, small and frequent meals. Okay, second thing is preferable to eat the complex carbohydrates. Okay, and if you're taking metformin in the morning, I would suggest to take one in the night also, so that the fasting sugars also will come under control. And if you're still having symptoms, I think it's better you visit the endocrinologist once. We can look into the matter deeply.
So would it help to check the post-lunch sugars, post-dinner sugars also at home, like home monitoring of sugars?
Yes. So the self-monitoring of blood glucose is very important because it primarily empowers the patient to have check on his sugar levels and then take the appropriate action. So if the patient is just doing his lab values, it might be difficult to get an idea of the 24-hour values of the blood glucose levels that are changing. So if you advise for home-based self-monitoring blood glucose levels, the clinician will definitely have a better idea of what are the fluctuations of the blood glucose levels that are happening over the day, and based on this the medications can be changed.
Yeah. I think even the fluctuations of the sugars is also very, very important. Not just the HbA1c, which we check once in 3 months, which will tell us the average sugar control. Sometimes we might be having high sugars and low sugars, but when you check the A1c, it might be normal. Okay, but these fluctuations are dangerous, and especially when you have a hypoglycemia that can trigger, a cardiac event. Okay, so Dr. Justin, could you tell us, what are all the tests that we generally do for the patient who has diabetes? What are all the mandatory tests that they need to do, in a year's time?
So, like Dr. Spurgeon mentioned, the HbA1c should be done. If the patient is uncontrolled, it needs to be done once in 3 months. If the sugars are under control, the bare minimum would be twice a year. In addition to this, the blood cholesterol levels should be looked into, and the urine examination is very important to look for early evidences of any damage that has happened to the kidney. Particularly, there is a test called an albumin-creatinine ratio, which your doctor might ask you to look for an early damage that has happened to the kidneys, and the electrolytes and also the kidney function must be minimum screened on an early basis.
And added to that, you need to also have the retina checkup, at least once in a year. Okay, so these are the bare minimum tests that we need to do every year. Okay, so especially the kidney functioning test, which Dr. Justin has mentioned, albumin creatinine ratio or as a urine microalbumin. Okay, if you are able to detect this one, okay, there are some medication which will prevent, so that the kidney damage will not progress. Okay, so therefore it is important to diagnose early, and so that we'll be able to give some medication so that the kidney problem will not progress.
But Dr. Spurgeon, like many of them ask, why should we do eye checkup? I don't have any symptoms. I am doing well. I can see clearly. I am using spectacles. Why would you insist on a regular eye checkup?
Yeah. So diabetes is a silent disease. Some people, they can present to the emergency with a kidney failure, and that's the time when you check the sugars, they'll be having the new onset of diabetes. It is a silent disease. If the sugars are not under control, it can virtually affect every organ in the body, right from the head to toe. It can affect your brain and can cause a stroke. It can affect your retina and can cause blindness. In fact, the most common cause of blindness apart from the cataract is diabetes. The most common cause for the non-traumatic amputation of the legs is diabetes. The most common cause for the kidney failure is diabetes. It can affect your heart, it can affect your kidney, it can affect your nerves, it can affect your foot. So virtually every organ is affected in the body. But with screening, we'll be able to diagnose early, and there's a possibility of giving medication, and there's a possibility to do some interventions with the retina. So suppose if you have some macular edema, or else if you have some bleeding, the ophthalmologist can look into that one, and they'll be able to prevent the visual loss. And therefore it is very important to screen all these things on a regular basis.
So the good news is that just with screening, the bare minimum, a lot of complications can be detected, and further complications can be prevented.
We have another question from Mr. Jogan. My wife is pregnant. What diabetic diet would you suggest her?
So, like I mentioned before, the important thing in pregnancy would be to have an adequate diet so that the weight gain is adequate. We don't want the patients to have a severe diet restriction and then there is a decrease in the fetal weight. And so the plate model which I mentioned about earlier can definitely be used. Never miss on the mid-morning snack. If the patient feels hungry, then the main meals can be cut into two, and so that is one way in which we can reduce the amount of caloric intake, but at the same time make sure that the patient is eating adequately. And of course walking, like I said, is very important.
Dr. Spurgeon, who should have very good or strict control of sugars? We've been telling like sometimes old people they can have lenience when they're controlling the sugars, or young people they say we should have this strict control. So who should have strict control?
Yeah. So we need to look at the age of the patient. Okay. We also need to look at the comorbid conditions that the person is having before we decide, how tight we need to control, how tight the HbA1c should be. For example, in pregnancy, okay, we try to keep the sugars very tight. Okay, if you are having diabetes and then you become pregnant, the targets of HbA1c could be like less than 6 or even less than 6.5. Okay. But apart from the pregnancy, if you are a young man, maybe 30 or 35 or 40, whatever the age it might be, if you do not have any comorbid conditions, the best thing is try to keep the sugars as low as possible. Okay, even A1C is less than 7 and less than 6.5 because you have only diabetes and no other comorbid conditions. Okay, but if you have any comorbid conditions like especially the cardiovascular disease, you have or you underwent maybe stenting or else you had a bypass surgery. In this group of people, it is very important to prevent hypoglycemia because the tighter you control the sugars, as you try to keep the A1Cs at a lower range, less than 7 and less than 6.5, the chances for you to develop hypoglycemia is much more. So in this group of people who have the comorbid conditions like the hypertension or especially the cardiovascular disease, the first priority is that we need to prevent hypoglycemia because hypoglycemia can trigger a fresh cardiac event. So in this group of people, maybe A1C of 7.5 is acceptable. And the third group of people who are elderly, okay, or else the life expectancy is very, very less. In such group of people, also the geriatric people, geriatric age group people, we don't try to keep the sugars under tight control.
Okay.
The fact being that when you keep the sugars at a very, very low level with the tight A1Cs, as I have mentioned, the hypoglycemic episodes can be high. And sometimes these elderly age group people, they can have because of frequent hypoglycemic episodes, there can be a decline in the cognitive function. Okay, so we need to look at the age group, we need to look at the A1C, we need to look at the comorbid conditions, and based on these things, we need to determine, what sort of a glycemic control is, acceptable for that group of people. And even patients with chronic kidney disease, there's no point in going for the tight control. Okay, the priority will be, keeping the, avoiding the hypoglycemia, and keeping the sugars in an, acceptable range. Do you want to add on, Dr. Justin?
Yeah, so those patients with comorbidities, especially if they have a heart failure, a kidney failure, or a hepatic failure, in those groups of patients, we would not like the sugars to be very stringently controlled. We would like to maintain the HbA1c, like Dr. Spurgeon said, around about 7 to 7.5%. And many patients do ask me, sir, aren't these sugars high? So at that moment, it would be important to explain to them that at this point, the comorbidities kind of determine what is the sugar control that the patient should be having.
We have another question from Mrs. Susanna. Because of this COVID situation, they are unable to go for regular tests. So when do we check the sugars at home, like before breakfast or after breakfast?
I think it is preferable to check both fasting as well as a postprandial. And the important thing is that not to stop the medication, okay?
Yes.
And if the sugars are under reasonable control, okay, it's better you continue the same medication. Yeah.
There's another question. In this COVID situation where we are not able to see the doctors, how long can we keep checking and controlling medications ourselves? We are not able to go to the hospital and check.
Yeah.
So one of the things that the Medical Council of India has now authorized for use in hospitals is known as the teleconsultation, and whereby the patient can have a virtual discussion with the doctors over the telephone or over many of the apps that are available. And even if the lab values are not there, the self-monitoring blood glucose values could help, and based on that, the doctors could take a decision whether the dose of the medicines has to be increased or decreased.
Okay.
Yeah. I think we started e-consultation if they are not able to come physically, with the blood test they can have an e-consultation. I think we should be able to guide them appropriately in this.
I think we also have the home delivery of medicine.
Medication, yeah.
If
Some
patient-
people are running out of stock with regards to the insulin and tablets, so the home delivery is also possible now.
We have another interesting commonly asked question. Is diabetes reversible, curable?
Yeah. So, Dr. Jason, you can start.
It would be very dicey to answer this question. There have been some evidences from recent trials that tell us, yes, with a very strict diet control and weight loss, reversal of diabetes has happened. But they have all occurred under research settings with the monitoring by the concerned research coordinator and a dietitian and the exercise consultant. So all of them decide how much of a caloric intent, and they also have a desired weight loss. So those kind of measures have shown us that diabetes can be reversed, but usually on the whole it's usually a progressive disease.
Yeah. As Dr. Justin has mentioned, so this reversibility is strongly linked with the weight loss. Okay, you need to understand that type 1 is irreversible. Once you have it for lifetime. But for type 2 diabetes, because it's a lifestyle disease, if you are able to change your lifestyle, lose the weight, and if you continue to maintain that one, okay, then there is a possibility of maintaining, normoglycemia, okay, and especially with the bariatric surgery, okay, and people who have diabetes and hypertension, if they fit into that BMI, where you go for the bariatric surgery, and you'll be able to lose approximately 25 to 30 kilos. And we see people, where they were able to maintain the sugars without any medication. A1C is perfectly in the non-diabetic range. But again, if they continue to put on the weight, again, they will have this diabetes and the hypertension. So it is very strongly linked with, the weight gain and how much, how you maintain that weight once you lost that one.
And the thing to be noted is that this reversal of diabetes is usually observed in those patients who have got a good beta cell reserve.
Yes.
So if you have a patient who has got diabetes for a long term, chronically uncontrolled, then the chances of reversal are pretty low. But those young patients who have been recently diagnosed, in which we could expect a reasonable amount of beta cell reserve, we could think that there could be a reversal of diabetes provided the conditions and the measures are put into place.
And even for the bariatric surgery, okay, it's better if they are choosing to go for the surgery, do it early before the beta cell is exhausted. So if the beta cell is exhausted and then you go for the surgery, the benefit will be less. But overall, definitely there will be a benefit.
I think the other cardiovascular risks and hypertension.
Yeah, hypertension, other benefits will be definitely there. Yes.
Yes, we have another question from viewer. This is Mary J. Mary, she's asked two questions. One is, I eat sweet occasionally and I increase the dose. Is it for a particular day? Is it okay? And what is your opinion on insulin pump, and is it effective, and do you do it in Baptist Hospital?
Yeah.
So going to the second question first, what is your opinion about insulin pump? So studies have shown that insulin pump is the best modality of treatment for diabetes. Particularly, it would be the best modality in type 1 diabetes, where there is an absolute deficiency of insulin, and just a small change in the dose could lead to either increased blood sugars or low blood sugars. So in that aspect, if we have an insulin pump which is also attached with a continuous glucose monitoring system, we could have a 24-hour vision of what the sugar levels are like. And some of the most modern insulin pumps, which are also quite expensive by the way, they have low glucose alerts or low glucose suspends, which automatically cut down the insulin levels if the glucose monitoring system detects that the sugars are going low.
Yeah. And just to add on to what Dr. Justin has said, it is preferable, in type 1 patients, type 1 diabetes patients, especially people who have hypoglycemic unawareness. That means when you have low sugars, you are not able to have the warning symptoms like the sweating and the palpitation, hunger. So directly you will be going into the coma. So people with hypoglycemic awareness and with the complications and labile sugars, rapid fluctuation of the sugars, those are the kind of people who will definitely benefit with this insulin pump.
So it's more of a type 1 diabetic who may need it?
Not necessarily. It can be used even in type 2 also, but it's generally used predominantly by the type 1 patients, and especially, in our country, finance is a huge thing. It will be called, the modern machines pumps will be costing around 5 lakhs approximately. 5.5 lakhs. And added to that one, the tubings and then all the additional accessories, they'll be costing approximately 15 to 20,000 every month. Okay. Yeah.
And one more question.
And the other question is that, in case if you are eating sweet, can I increase the dose of insulin? Absolutely, you can do that one. As you are, this is basically problem with the carbohydrate metabolism. The proteins that you take will be digested normally. The fat that you take will be digested normally. But the carbohydrates that you eat, when they are converted to glucose because of the lack of insulin or as a deficient action of the insulin, the sugars are going high. Okay, in people with type 1 diabetes, the ideal thing to do is that the patients need to be taught about the carbohydrate counting. For example, if you take a slice of bread, it contains maybe 10 to 15 grams of carbohydrates. For example, if you take one idli, it may has around 80 to 85 calories. So we need to calculate the carbohydrate content of what you are eating. Okay, if you are able to count the carbohydrate content, based on that we'll be able to take the additional dosage of insulin. Okay, but even if you don't know how to count the carbohydrates, okay, but whenever you want to eat an additional sweet or else additional carbohydrate, there is no harm in increasing the dose of insulin, maybe 2 to 4 units, depending upon how much additional carbohydrate you are taking. This is perfectly acceptable.
Only start making it as a habit, Dr. Spurgeon. Some people have a sweet tooth. They'd like to have it every day.
Yeah. So there are two aspects for this one. Number one is we also need to look at the weight of the patient and the amount of calories. Okay. So we cannot take on extra calories and put on additional weight. Okay. So we need to balance the weight of the patient and the amount of calories, and then once in a while having this kind of ice cream or whatever it is. Okay. But if you are type 1 diabetic, the good thing is that if you will be able to count your carbohydrates, you will be able to fix the ratios. How much insulin need to be given for how many grams of carbohydrate. Approximately it is 1:10 to 15 grams of carbohydrate. 1 unit of insulin is required for every 10 to 15 grams of carbohydrate. So you can take extra 30 grams of carbohydrate and you can take extra 2 units of insulin. It is perfectly acceptable.
So coming to the sweet tooth issue, I think if the patient has got a craving, it would be acceptable to tell the patient, you take the smallest portion possible of the sweet, so that the craving is overcome. So that would kind of help the patient to tide over this issue.
We have another question from Mr. Easow Sam. Is keto diet helpful for diabetic patients and does it reverse diabetes? Dr. Justin.
So keto diet, yes, it is a little bit of a controversial issue. Keto diet is a little bit of a controversial issue, whether it reverses or not the diabetes. So the problem with all kinds of diet is it does not have a long-term sustainability. So the problem is the moment you stop the diet, you go back to the old situation, or maybe even worse than the old situation, in which the sugar levels can just shoot up. Another problem is a long-term keto diet could lead to ketogenesis in the body, which might not be good. I heard from another doctor that a patient who was driving and he never took alcohol, but the breath analyzer test came positive. So then the patient asked the doctor, "Doctor, I have not taken alcohol. Why is my breath analyzer test coming positive?" So then he was on the keto diet. So these kind of diets can cause all kinds of funny reactions in the body, and maybe a long-term diet, keto diet, or may not be very good.
Yeah, long run it is not good for the body because we are putting additional load on the kidney, especially when you take lots of protein. My simple analogy is that we can run the car with petrol, sometimes even with kerosene. But if you continue to use the kerosene for a longer time, it is not good for the engine. I think the same thing applies even with the human body, I suppose. Yeah.
We have another question from Mr. John Varghese. Does diabetes cause insomnia?
Generally, it doesn't cause insomnia, but in case if you're having insomnia, I would strongly suggest you to check the sugars, in the middle of the night. Maybe you are having hypoglycemia and that is causing the sleep disturbance. So it is better for you to check the sugars in the middle of the night.
So check it at any time, like 1 o'clock or 3 o'clock.
Whenever you get up, maybe 2 o'clock or 3 o'clock, you know.
Yeah.
So
Midnight.
generally the sugars go down at around about 2 a.m. to 3 a.m. and after that we see the pattern of the sugars coming. So that's what happens in a normal patient, not a diabetic patient.
Okay.
So it would be good to check at 2 a.m. or 3 a.m. I have cases in which patient had told that he was having nightmares and sometimes it was caused by this hypoglycemia.
We have another question from Mr. Banaya Tirlok Rajakumar. My checkup was due in the month of March, April 2020. I am continuing the medicine. I will not be able to go over there for checkup since I am more than 70 years and I live in Andhra. This present situation of lockdown, I have to obtain a e-pass. Can I have my blood test tested locally and send you the report? I am continuing the medicine you have given. I am, by grace of God, doing well. This is the son of the patient, I think.
I think this is perfectly possible. They can do all the blood tests required, the fasting, the postprandial, HbA1c glycosylated hemoglobin. If you haven't checked your kidney function test in the recent past, maybe you can check those things. And you can send those reports and we can have an e-consultation, you know, this is perfectly possible. I think one of our team members will be able to, you know, take this forward. Thank you.
Yes, we have another question from Mrs. Jane Mary. What about teeth and gum care and diabetes? I think it's an excellent question.
Yeah. So periodontal disease is a known complication that occurs in diabetes, and it is very important that the patient has a regular dental checkup so that the health of the teeth is ensured. And of course, added on to that, the general instructions of taking good, having good oral hygiene is very important. And if any cases of halitosis, please go consult your dental expert.
I have another question. Is insulin safe?
It is very much safe. It is physiologically produced by the pancreas in our body. Okay. For type 2 diabetes, it is possible to control the sugars with diet and with exercise. If the sugars are not controlled with these two, with oral medication. But sometimes, if the sugars are not controlled despite diet, exercise and oral medication, then we have to go for insulin. As I have mentioned earlier, it is a dynamic disease. There will be a progressive deterioration of the beta cell function which produce the insulin in our body. So when the sugars are not controlled, I think there is a strong indication for us to start insulin. Okay, taking insulin will not cause any problem, but now uncontrolled sugars will cause the problem. Taking insulin will not cause any kidney disease. It is the uncontrolled sugars which will cause the kidney disease. So Dr. Justin, could you elaborate the indications for insulin?
So uncontrolled diabetes mellitus is a definite indication for taking insulin. The recommendation says that an HbA1c of more than 9 should receive at least 1 dose of insulin, if not 2. And the other indications would be to start insulin if the patient has got weight loss, if there are any uncontrolled infections that the patient is having, if patient is having an acute cardiac event, or the patient has got a stroke. So these would be the general indications to start insulin without thinking further. Adding on to what Dr. Spurgeon said, many people come and do ask me the question, sir, will I get addicted to insulin? So I have to strongly tell them that no, there is no question of getting addicted to insulin. The question of whether you should be on long-term insulin depends on how your blood sugar levels are going to come down. I have had many patients in which I have been able to stop insulin who had a reasonable control of their sugars, but there are cases in which the insulin should be continued. And another query usually comes, someone has told me, a neighbor has told me, for example, that after taking insulin, his father's kidneys have failed. So like Dr. Spurgeon mentioned, it is not possible that such a kind of scenario comes. because it is usually due to the uncontrolled diabetes that the kidney damage occurs, and insulin needs to be started to prevent the further damage to the kidneys or to conserve whatever remaining amount of the kidney function is present. So no, insulin is not addictive and insulin does not cause any damage to the body.
Yeah, just to add on to the complications with regard to the diabetes, especially the kidney problem. Once you have diabetes, it is there with you for lifetime. It is very important for you to control the sugars right from the beginning, because if you don't control the sugars right from the beginning, you will end up having complications. But if you are able to control the sugars right from the beginning, you will be able to delay the onset of complications. For example, in diabetes, in India, we are seeing people who are diagnosed with diabetes at the age of 30, 35 years, almost every single day. This group of people, if you do not take control right at the beginning, you might end up having a complication because of the diabetes, maybe a end-stage kidney disease, kidney failure, or else you will have a cardiac event. Now imagine you will be hardly 50 years and you might be the only breadwinner in your family, and there are dependents, children who are in their teenage, they are dependent upon your earnings, but the whole family situation will be upside down. But on the contrary, if you are able to control the sugars right from the beginning, you will be able to delay this complication by maybe 10 or 15 or even 20 years. And imagine the whole family is settled. This makes a lot of difference. This makes a tremendous difference, for the family and also for the children. Okay, I think it's very, very important, keep the sugars under control right from the beginning. Regular monitoring, very, very important, because it is a dynamic disease. So that ultimately we are looking at delaying the complications as much as possible. That's very, very important.
I have another question, the last question for the
I
day.
want to talk what Dr. Spurgeon said. We have data indicating that the initial 10 years of diabetes is the most important. So if you have missed that, then you have missed your golden time. And no matter how much amount of blood sugar control you might do later on, it will not still prevent the complications. So the usual trend is that I don't have any complications, I am taking my medications, but the blood glucose levels are not controlled. So that should not be the way in which we look at things. Make sure that the initial 10 years of your diabetes is well controlled.
That's a golden period.
Do you suggest any vaccine for a diabetic patient?
Yes, it is important that diabetic patients take vaccines. We have recommendations for that. So you need to definitely take your yearly influenza vaccines, and in addition to that, you should be taking your vaccines to prevent pneumonia. And if you have not taken your hepatitis B vaccine, it is important that elderly patients should take their hepatitis B vaccines as well.
We are coming to the end of the session for today. I want to thank Dr. Spurgeon and Dr. Justin for joining us today. I think it was wonderful that it was quite an informative session, and thanks to all the viewers for asking numerous questions. We still have a lot of questions. We are running out of time. I'd like to thank Dr. Spurgeon, Justin, and the team who just planned organizing today. And
thank you very much for your patient listening. It's very nice of you to be able to connect virtually.
This will be followed by another topic on 2nd of June, which will be held by Dr. Saravanan on heart attack. He's a senior cardiologist at Baptist Hospital, Bangalore. So hope you meet next time soon.
I would also like to thank Dr. Vinod for moderating the session.
Yeah.
It's been wonderful.
Thank you very much, Dr. Vinod, for moderating. I think even in the days to come, we'll be coming with more interactive and interesting sessions from Bangalore Baptist Hospital. Keep a watch on our website and also on our Facebook. Thank you so much, and God bless.
Thank you. Stay safe.